Performing administering medication through a feeding tube. First is introduce your name and identify the patient. Hi ma'am, I'm Harley Gama Jr. I'm a student nurse and you are? After that is provide client privacy when performing the procedure by closing the door and by closing the curtain. Then the next step is explain the procedure. So explain at his or her level of understanding. Then the next step is position the patient properly. So with the head elevated at least 30 degrees or sitting position. Then after that is gather the supplies that need into the procedure. So we have a non-sterile gloves, we have a towel, we have a tap water, warm water, and we have a syringe, and also we have a prescribed medication. Then after that is procedure in administering medication. So first you need to check the administration form or record, also the medical provider form, and also you review the administration medication form and the patient or guardian consent form. And also you need to check the medication if it's expired or not. Then after that, preparation for liquid medication or water that used into the procedure. And also the water that used into the procedure. Then after that is perform hand washing. After performing hand washing, next step is apply the non-sterile gloves. Then after applying non-sterile gloves, next step is you need to check. So you need to check the placement of the gastrostomy tube. You need to check the gastrostomy tube. Then after that, you need also to put the towel under the gastrostomy tube. Then after that is the next step that you need to do is to observe also the abdominal. So the abdominal or for signs of malposition or obstruction of the gastrostomy tube. Then after that is if the patient have a abdominal distension, do not administer medication. So instead of that, you need to contact the parent, guardian, or healthcare provider. Then the next step that you need to do is to irrigate tube. So irrigate tube by using the syringe. So using syringe, so this drew water into the syringe. Then after that, insert the tip of the syringe into the feeding tube. So insert, then flush the water. So before flush, you need to open the clamp. So you need to open the clamp. So flush. Then after flushing, close the clamp. So after close the clamp, you need to remove the syringe. Then after removing the syringe, next step is you need to remove the valve or plunger of the syringe. Then after remove, you need to reinsert the tip of the syringe into the feeding tube. Then the next step that you need to do is to administer the first dose of medication. So administer first dose of medication. So in administering medication, make sure the medicine is allowed to flow by gravity. So administering, then open the clamp. Then after administering the medication, flush again by using the water. Then after that, administering again the medication. So after administering, so always put in your mind the step is flush medication. Then after administering medication, you need to close the clamp. Then after that, you need to remove the syringe. Then after remove the syringe, you need to close the to cut the end of the tube. Then after that is, then after the administration of medication, the next step is that you need to do is to position comfortable the patient. So with the head elevated, in on the bed. Then remove the towel. Then after removing the towel, next step that you need to do is to dispose soiled supplies into the appropriate receptacle. Then after that is remove the gloves and dispose in appropriate receptacle. Then after that is perform hand hygiene and perform hand hygiene. Then after that, after the procedure, next step is evaluation. So in evaluation, you need to observe the patient if there is a aspiration, then also you need to return within 30 minutes to evaluate patients in response of medication, and also identify the unexpected outcomes. Then after that, document your medication or administration of medication on the administration medication record. Thank you.